Hi, everybody. This is Dr. Jenny Byrne at Cognitive Psychiatry of Chapel Hill. Um, Welcome to another part of our series on lessons I've learned from my patients. It's Monday. I'm a little early today at 8:30. It's a pretty dreary day in North Carolina, but spring is almost here. Things are flowering, so things are looking good for us here. Anyway, welcome back if you've been following the series. Been talking about some different topics, lessons I've learned from my patients over the years. And today I thought I'd talk a little bit about dementia. And this is something that I see a good amount of in my practice, but really more specific than dementia, kind of this idea of cognitive impairment. And what do I mean by that? So cognitive is really everything that has to do with thinking. That's a good way to conceive of it. So things that have to do with learning, with memory, with attention, focus, organization, being able to execute complicated tasks. These all fall under kind of an umbrella of cognition. So when people think about dementia, really quite often they're thinking about problems with memory. And memory is an important part of cognition, but it's not the only part. So why does this matter other than technical terms? Why it matters, and this is what I've learned from my patients over the years, is that even though something might sound like dementia, look like dementia, and sound like and function like dementia, it's not always dementia. So this is a little bit of that saying, I think if it looks like a chicken, walks like a chicken, sounds like a chicken, it probably is a chicken. In the case of dementia, that's not always the case. And the reason that is, I think, is because we're very familiar with the idea of dementia from movies and the press. We hear a lot about Alzheimer's, and so we're very familiar with that concept. So if somebody is getting older in their 60s or 70s and they notice trouble with thinking, they tend to jump to the conclusion that it's memory that's the problem and that it's a dementia. The fears of dementia, especially, I see a lot of people who have had dementia in the family, like they've watched a parent or a grandparent or a sibling go through dementia, and it's can be really, really rough and heartbreaking, and they understandably have a lot of fears that that's what's going on with them and that that's going to happen to them. So what I've learned over the years, though, is that just because someone is worried about dementia and is having trouble with their thinking or their cognition, that doesn't mean they have dementia. And in fact, a lot of the times, what I see is that people are actually depressed, or in some cases, very, very anxious. So this ties back into some of the other sessions I've talked about, lessons I've learned on depression and anxiety. So when somebody's a little bit older, again, late 50s, 60s, 70s, and they have trouble with their thinking, they tend to assume that they have dementia. And that is often not the case. So what I've learned is that many people in this situation are actually very depressed. And when you are depressed, you have trouble with your cognition, but it's a little different than Alzheimer's dementia. So instead of just seeing trouble with short-term memory as being very prominent, like in Alzheimer's dementia, when you have depression, you tend to have a lot of trouble with attention and focus and concentration. So this can look like a memory problem because if you can't pay attention to something or you can't concentrate on something, you can't get it into your memory in the first place, right? So if you're reading, for example, and you're reading a novel and you've read the first chapter, but you really weren't able to concentrate on it, you're not going to remember what was in that first chapter. So you're going to get to the end of the book and you're going to say, well, I don't really remember what happened at the beginning. Maybe I have a short-term memory problem. But in fact, you don't have a memory problem as much as you have a concentration problem. So I'm not sure if that makes sense, but that's something I've learned a lot from patients, is that memory problems sometimes are actually concentration problems, and that they can be very related to depression. So if somebody comes to me, again, a little bit older, 50s, 60s, 70s, and they're worried about dementia because they're having trouble with their thinking and they had a family member that had dementia, one of the first things we need to do is make sure they don't have depression. And then if they do have depression, make sure that we treat the depression, and then we look at their thinking and their cognition. And I'd say about 9 times out of 10, when I have someone come into me and they are depressed and having trouble with their thinking, most of the time when we treat their depression and their mood is better, their thinking also goes back to baseline. And that may not be the baseline they had when they were, 25 or 30 years old, but it's a normal age-adjusted baseline for someone in their 60s or 70s. So I think the take-home here is that if you or someone you love or care about is having trouble with their thinking, it may not be dementia. So you don't have to jump to that conclusion. One thing is to really make sure they're not depressed. And it can be pretty profound. I've had some patients come in and look like they could have dementia and be very depressed, and then we treat their depression and they look so much different, like they look like a new person. And they'll tell me, I can't believe how foggy things were. Like, I don't even remember the last 6 months because it was just such a blur and such a fog. And that was all related to depression. So sometimes it can be quite impressive. Another thing I've learned from my patients is that when they are depressed, sometimes what happens is they only get treated part way. So their depression gets partially better, but not all the way better. And so when it's only partially better, sometimes their cognition is also only partially better. So they'll say, well, my depression is better and I'm still having trouble thinking. But then when we get into a little bit deeper, we find out that they're still actually pretty depressed. They're not back to their mood baseline. And then if you push the treatment a little further and you get them into remission or you get their baseline back, then in fact their thinking gets better. And sometimes it's a little slow, like sometimes the depression gets better and then it might take another 6 months to get their thinking totally clear again. Or sometimes it's very sudden. So that I think is variable. But then a lot of people will tell me after we treat their depression and their thinking gets better, then they start to tell me about all the fears that they had about getting dementia. My mom had it, my dad had it, it was just terrible. I was convinced that was what was happening to me. And then that was making me more depressed. And then that was making my thinking worse. And it just kind of went like a cycle. So a lot of people, I think, won't share their fears right away. They'll wait and they'll keep the fears to themselves. And then that can sometimes set off a negative spiral. And they don't come in to help to get care until things are really, really bad. So I urge you, if you or someone you know is having trouble with your thinking and maybe some depression or you're not sure, get in sooner rather than later. Don't wait until it's a terrible depression and you're not functional and you think you have dementia. And don't wait that long. Just get in and get some assessment done early. I think it's very scary for people to get that assessment done because they're fearful that they'll get a dementia diagnosis. But often they'll find out that it's depression or something else that they can treat. So don't wait. I really recommend trying to get in sooner rather than later, and talk with someone who can help you with your fears too, not just a medical workup where you check off the boxes and say, yes, I don't have dementia, but maybe talk with someone, a counselor, someone can help you with your fears about getting dementia and what that would mean for you. And maybe next time we'll pick up on this topic and I'll talk a little bit about the people that I see who do get diagnosed with dementia and what that means for them. But again, in a lot of cases, cognitive impairment doesn't mean dementia. So if you're concerned and you're not sure, please reach out and get some help. If you'd like to contact us, all of our information is here, or someone local for you. But I hope this has been helpful, and I hope you have a great week, and I'll see you next time. Bye.